This is my area. This is my supplies. This is my uniform. Okay. So the first thing I would do when starting out my skill was make sure that I was in an interruption-free zone. I would make sure that the door was closed to the med room. I would make sure that I didn't take any calls. I would limit any conversations to a minimal unless it was very important information. I would not be distracted, and I would follow my hospital's policy for no interruption zone. So the next thing I'm going to do is I'm going to compare my MAR to my order sheet. So this is my order sheet, and then this is my MAR. Okay, so the first thing I'm gonna do is start out by comparing. So we have Jaguar J. Jones, Jaguar J. Jones. My second identifier is MR number 417-6352, MR number 417-6352. Medication, we have morphine, 5 milligrams, IM, every 4 hours, PRN for pain, and we have an allergy to penicillin. So now I'm going to take my order sheet and I'm going to place it away, and I'm going to perform hand hygiene. And now I'm going to start my first take of accuracy. So for the first take, we have right patient. So I have Jaguar J. Jones, right medication, morphine. So I'm going to select my morphine, and this is my morphine. And now I'm going to check the expiration date, and I do see it's 12/20/25, and it is not expired. Okay, so now we're going to go to correct dose. So I see we have 5 milligrams ordered here on the MAR, so I have 10 milligrams per milliliter in my vial, and I have calculated that to be half a milliliter. Anytime I would make any calculations, I would always verify with another nurse that it was correct and what I was doing was all accurate. So now I'm going to move on to right route. So it is an IM injection, so these are my supplies. So I have a 3 milliliter syringe, I have a 23 gauge 1-inch needle, and I have a blunt plastic cannula. So now I'm going to get everything ready so I can draw up my correct dose. I'm going to make sure not to touch. Then I'm going to get my blunt plastic cannula, making sure not to touch. I'm going to screw it on. Okay, so now I'm going to clean my vial. And then I'm going to check one more time to make sure what I'm doing is correct before I draw up any medications. I have 5 milligrams ordered, 10 milligrams per milliliter here on my vial. That is half a milliliter. And anytime I draw up a high-risk medication, I would always check with another nurse also to make sure that I'm drawing up the correct dose and everything is also correct. So then I'm going to draw up half a milliliter of air. Okay, then I'm going to take this off. I'm going to push in my half a milliliter. I'm going to draw up half a milliliter, making sure there's no air bubbles. Okay, take this out, and then I'm not going to touch, I'm going to scoop. Okay, then I'm going to verify, make sure no bubbles are in it. check one more time that I've drawn up everything right. So I have 5 milligrams ordered, 10 milligrams per milliliter, that is half a milliliter. I would have made sure that I checked with another nurse, and this is half a milliliter. Okay, so now I'm going to move on to right route. So it is an IM injection, so I do need to take off my blunt plastic cannula and put on my 23 gauge 1-inch needle. So I'm going to do that now. So I'm going to take it off, place it directly into my sharps container. Then I'm going to get my needle. Not going to touch. I'm going to screw that on. Okay. So now I'm going to move on to right time. So we have every 4 hours. So it has been 4 hours. It is good. Now, right indication, PRN for pain. Mr. Jones is in pain. And right documentation, all elements of a legal prescription are here. So now I'm going to move on to my second check of accuracy. So I'm going to start out, right patient, Jaguar J. Jones. Okay. Right medication, I have morphine ordered. I have morphine here on my vial, and I have morphine here in my syringe. Now, we're going to move on to correct dose, 5 milligrams. Here's 10 milligrams per milliliter here on my vial, so I calculated half a milliliter, and I did put half a milliliter in my syringe, and I am identifying that I did do that. Now, we're going to move on to right route, so I have IM, and this is the correct syringe and needle for IM. Now we're going to move on to right time, every 4 hours. It has been 4 hours, so it is good. Right indication, PRN for pain. Mr. Jones is in pain. And right documentation, all elements of a legal prescription are present, and they are. So now I'm going to make me a label. I'm going to get me a little piece of tape, and I'm going to correctly go from my MAR to my label to make sure that everything is getting correctly. So I have name, Jaguar J. Jones. We have right medication. I have morphine on my MAR, morphine in my vial, and I have morphine pulled up in my syringe. Now, I'm going to write down the correct dose. So we have 5 milligrams ordered, 10 milligrams per milliliter. I calculated half a milliliter, and I have half a milliliter pulled up in my syringe. So I'm going to write 5 milligrams / 0.5 milliliters. And I'm going to check to make sure I wrote everything correctly. I'm going to go back one more time. Jaguar J. Jones, Jaguar J. Jones, morphine, morphine, morphine in here, morphine. Correct dose, we have 5 milligrams ordered, 10 milligrams per milliliter, half a milliliter is what I calculated, and I do have half a milliliter in my syringe, so that is what I have written down. Here we go. I'm going to place that on my syringe. Okay, so now I'm going to gather all of my supplies to take to my room. So I have my syringe, I have my medication, I have my MAR, and I'm going to bring me an alcohol pad to clean the area. So then I'm going to go in the room. I'm going to perform hand hygiene. Then I'm going to explain the procedure to Mr. Jones. So, hey, Mr. Jones, my name is Jaylee Freeman. I'm a nursing student here at South Alabama. I'm here to give you an IM injection for your pain. So then I would assist him to a comfortable position. I would raise his bed, lower his side rail, get everything ready. Then I would start comparing his armband to my MAR. So I have right patient, Jaguar J. Jones, Jaguar J. Jones, second identifier 417-6352, MR number 417-6352. We see an allergy to penicillin. Allergy to penicillin. Mr. Jones, do you have any other allergies? Just to make sure. Okay. So then I would do any necessary pre-administration assessments for my specific medication, such as blood pressure, pulse, respiratory rate, lab values, and any pain assessments for the specific medication that I'm given, which is morphine. So I have correctly identified my correct patient. So now I'm going to make sure I'm going to go to correct medication. So I have morphine, morphine, morphine pulled up in my syringe and also here on my label. Then we're going to go to correct dose. 5 milligrams ordered. We have 10 milligrams per milliliter. I calculated half a milliliter. And I do have half a milliliter pulled up in my syringe, as I also have it written here on my label. Now we're going to go to right route. So I have IM. I have the correct syringe and needle for IM. Then we have right time every 4 hours. And it has been 4 hours. He's ready. Then we have right indication, PRN for pain. Mr. Jones sure is in pain. Right documentation. All elements of a legal prescription are here and present. So now I'm going to don my goggles and my gloves. And I'm going to move my stuff over so we can see. So the first thing that I'm going to do is I'm going to select the correct site for my injection. So I am giving an intramuscular injection, and a preferred site is ventrogluteal. I am going to place my palm on the greater trochanter, my thumb towards the groin, my pointer finger to the anterior superior iliac spine, my middle finger to the iliac crest, and I will go at a 90-degree angle straight into the injection site. I would also only expose the injection site, and I would also assess the skin and the muscles integrity for any bruising or any breakdown before I did give an injection. So now I'm going to clean. So I'm going to start from the middle to the outward and not overlap, and I'm just going to leave that right there. Then I'm going to get my medication. Take off the cap. Then I'm going to spread the skin, go in at a 90-degree angle. Big poke, Mr. Jones. Then I'm going to aspirate for blood. And I do not see any blood, so I can go, and I'm going to inject my medication. Then I'm going to pull out, place my pressure. I'm going to make sure not to massage. And then after that, I would lower Mr. Jones's bed, raise his side rail. I would assess to see if he had any allergic reaction. Then I would take off my gloves and my goggles correctly towards the trash. And then I would come back, go to the nurse's station and document the procedure and how Mr. Jones tolerated. And then in 15 minutes, I would come back and assess Mr. Jones again for an allergic reaction and see if he had any response to the medication, such as pain medication, and I did give morphine, so that is a pain medicine.